It's, look like we have a quorum and everybody's present, so let's get our meeting started. And first of all, I'd like to ask Representative Laricki if he'll lead us in a word of prayer.
Let's pray. Heavenly Father God, we love you. Thank you for another beautiful day. Thank you for how you bless us. Just guide us and direct us in all that we do. In Jesus' name I pray. Amen.
All right, and thank you very much for coming this morning to look at these study committees that basically we're looking at, and also a couple of resolutions that are urging resolutions. And our agenda this morning, we have first State Senate Resolution 149. Senator Michael Williams. Senator Williams, welcome.
Thank you. Thank you, Mr.
Which
Chairman.
mic, let me get, check and see if that's got your,
Is it working?
it is.
Again, thank you for your time this morning. This is a resolution that would designate September 1st of every year moving forward here in the state of Georgia as Childhood Cancer Awareness Day. As we all know, cancer is a disease that affects everybody, especially our young children. And there was a young lady in Forsyth County that brought this to my attention last year where one of her best friends died of childhood cancer awareness, and she has taken upon herself to work the system and try to make a day, again, every year where we can bring awareness to this, where not-for-profits can use this day to fundraise and help raise money so that we can do more to help solve childhood cancer awareness here in Georgia.
Do we have any questions from the committee? No question, I would entertain a motion. Move, do pass. Have a second. All right, motion and a second do pass. Is there any further discussion on the motion? Those in favor signify aye. Aye. Opposed? Motion carried.
Thank you.
Thank you, Senator.
I appreciate it.
House Resolution 1137. Representative Diffenbaugh.
Yes, sir. On the way. Mr. Chairman, thank you for the opportunity of presenting this resolution. It's an urgent resolution for the Congress and the President of the United States to be more aware and promoting them to do what they're supposed to do, and that is treating our soldiers with PSPT and any other abnormality that they have caused during their service. And it came to mind, I did this much earlier, but 2 weeks ago there was an event in the news that really solidified my thinking on this, is that there was a soldier, and I'm not sure where it was, up in New England somewhere possibly, that shot and killed the policeman and some other people, and they killed him. And it was determined that he had PSPT, and both the government released him, the military released him, and the Veteran Affairs said that they couldn't treat him, or that it was ineffective treatment. So this resolution will ask them to keep that soldier in service until he is at a point where he can rejoin the society in a much better condition. This would eliminate things like homelessness, abuse at home, children abuse, prison time, and all of these are related to service related abnormalities or conditions that they've encountered while in service. You know, sending someone to combat takes 6 weeks to 6 months, and they're trained very well to do this killing and to fight for us. But then afterwards, we have a habit of saying, oh, well, he's okay. And if you've been in combat, which I have not been, but I've talked to a lot of people who have, you're not okay all the time. And this makes it aware that the government needs to maybe better test, better process these people when they're getting ready to be released, so that it would save us all money, time, and most of all, that person's life, that he can rejoin society. So that's the effectiveness of it. Thank you for the time. Any
All right,
questions?
thank you. I have a question number 20.
Thank you, Mr. Chairman. Are you aware of any intake screening on these soldiers before they even go to combat? Does the military do that? You know?
I'm not aware of any. I know there is some calling out of people if they seem to have problems with the training, which is great. But I don't know of any detailed calling out of anyone before that time.
23.
Thank you, Mr. Chairman. I just wanted to give some context there for Representative Spencer. No, there's no intake, but I can tell you that the the psychological testing comes in basic training, usually within the first couple of weeks. And it's not a formal process, but I can tell you it is screening. And if all you have to do is go watch the first day of basic training to see how drill sergeants treat their incoming soldiers, and you get an idea for just kind of high pressure situations they're put under.
Number 3.
Actually, number 1, if it works.
Well, I've got 1, 2, and 3.
Okay. They're not lighting up. They're not lighting up.
Okay. Number 1.
Are you aware of any, that the military, federal government, they don't already do this type of assessments before and after soldiers return from combat?
I don't know the exact process on the intake. I do know that there's some psychological testing, but it's more or less like you were saying with the drill sergeant. He sometimes gets you to the point where you want to quit, and you do, and that's probably good. On the outtake, they say that there is a process that they have to go through. Have you been in combat? Yes. Well, are you suffering from any of these following conditions? No. Okay, you can go. I don't think the detail is sufficient to really come down to and answer the problems and help the soldiers that's there. And this is a small number of people considering how many people are in the military. You know, I don't know what the percentage is, but it's a pretty small percentage that people develop this PSPT or PTSD or these other abnormalities that should be screened, I think, a lot better than what it is. And a lot of times, if you have minor problems, they say, oh, Veterans Administration will deal with that. Well, they're not geared to do all that. They can offer conditions to go to maybe a counselor or something, but there's no sense of continuity.
Okay, and no, that was all. Oh, you have, okay. All right, I believe 20, is that Representative Turner?
No, it's me.
Oh, is she?
Sorry. Again. And we coordinated wardrobe today.
I understand. You all have glasses that look very similar. How's that?
For the record, I am Jason Spencer. Okay, question. On these outtake questionnaires, I'm just wondering if the soldier is potentially lying on the questionnaire in order to avoid being denied any benefit.
Well, usually if he would deny that, he would be, or let me backtrack. if they say they have problems, they will keep them longer. If they don't say they have problems, they're released. There's not necessarily more benefits. In
No, I'm
fact,
talking about a denial of a benefit.
okay, that what benefit would be denied?
I don't know.
I'm not aware of
Me
any.
neither, so I'm just asking, is there a concern of a loss of a benefit? Is that why they?
No, I think it's, and until recently, 10, 20 years ago, if a soldier said that they were having depression or other issues, they were kind of blackballed from getting promotions and from getting other discharge. But once they're discharged, the benefits kind of stop, other than what they can get from the VA.
Okay, thank you very much. And your resolution is an urging resolution to
That
the
is
President
correct.
and Congress to basically look at this issue more closely.
Right, look at it closer and take their responsibilities more seriously, because most of this stuff in this resolution already exists, but it's not being carried out, I don't feel, in a way that's helpful, not only to the person, but the person's family, and to the community, and especially to himself.
All right, I think if you might want to check with our Georgia Veterans Affairs. I believe they are in the process of rehabilitating one of the building in Milledgeville for this particular purpose.
Yes,
For the treatment.
They are, and they have read this and had given me a okay.
Okay, all right. All right, one more question, number one.
Oh, I'm sorry, proper time, I'd like to, make a motion.
It's proper time.
I move to pass.
I have a motion do pass and a second. Any further discussion? All those in favor say aye. Opposed? Motion carried.
Ladies and gentlemen, Chairman, thank you.
All right, next on our agenda is House Resolution 1160. Representative Hill, welcome.
Thank you, Mr. Chairman, committee members. I'm here to ask for your favor on House Resolution 1160 and the study of kratom, to working with the Assistant Deputy Director. There's a lot of questions out there. The effects, the length of the effects, and does it have a use, and does it need to be a Schedule 1, 2, or 3? In low doses, kratom acts as a stimulant. In large amount, it acts as a sedative. And the DEA says it can lead to psychotic symptoms. So there is a lot of response since I was here last, positive for it, and there's been a lot of response of those that are against it. So I can see there needs to be a study so we know where this, if it has, needs to be under more scrutiny, or how it needs to be labeled. And I would appreciate your vote in favor of the study.
All right, are there any questions?
Have there been any deaths associated with this?
You know, and that's a good question. There's been several deaths that it did show up in the system of that individual, but they can't say that that's what caused it.
Were there other co-metabolites?
There
in-
was.
Yeah. So we can't really say for sure this is a causal
Right.
substance to cause
And that's
death.
why the study needs to be, I think, carried out.
Number 21.
Thank you, Mr. Chair. I just wanted to address that. I don't know what the death rates are with this, but I do know that there are rehabs full of people sitting in places like Ridgeview, for treatment, trying to get off of kratom. So I definitely think this bears looking at and studying, because it's something that, people think is harmless, and we're selling over the counter like we did, back when synthetic marijuana was legal. And there's all these, addictions and extenuating issues that are stemming from it. And so I think, it definitely bears looking at.
Thank you.
All right, and let me add a little to this too. I think it was last year that this was added to the dangerous drug list. And there was a lot of discussion at that point in time, and there was not enough evidence to support either yay or nay, so it was taken off. And I appreciate you bringing this study committee, because I think it's something that does require some study, and I think you'll have a lot of participation in this, as there are strong feelings on both sides of this issue.
Yes, sir, thank you.
Number 20.
I just wanted to state that the FDA did show that in 2018 that there was no evidence that the substance was safe or effective for any condition, and some people take it for managing for chronic pain. So my question is are we headed down a policy that would prohibit the use of this if it was an alternative, whether it was safe or not? People can say that about marijuana. Whether or not that this substance is actually could be used as an adjunct to treat chronic pain rather than relying on the opioids. So I think we need to be careful when we go down this road, because we end up, Tylenol is not a safe drug. You take 4 grams of Tylenol over a 24-hour period or exceed that, you're going to die of liver dysfunction. Motrin will shut down your kidneys and cause a GI bleed, and that's an over-the-counter drug. So I just think we need to be careful about this.
Yes, thank you, I agree.
Number 16.
Thank you, Chairman. Thank you for bringing this bill. My question is, because I know absolutely nothing about Kratom. I think when you brought the study committee, was probably the first time I've heard it. Am I to understand that this particular drug is sold over the counter?
Yes, it is. You can buy it at the vape shops. And it's my understanding from my local corner that you can also buy it at the stop and go markets next to the candy.
Okay, thank you.
Number 23.
Thank you, Mr. Chairman. I just want to piggyback what Representative Spencer said and just ask you, as I think you're going to get your study committee, but I just ask you to keep an open mind on both sides of the issue. I hadn't heard of it before you brought this to us. My seatmate apparently is a big advocate for it. That doesn't mean much to me. I'm just saying, I think you know which one. The bottom line, though, is as you go into this, ask some questions that you don't know the answer to, and go where the data leads you, and not where you think any type of predetermined outcome should take you. If you find that this is something that's not harmful, it's okay to say that. If it is harmful, then let's deal with it.
Yes, sir.
Thank you.
I agree with you. Thank you.
Okay, thank you. I don't see any further questions. Do I have a motion on this?
Move to pass, Mr. Chairman.
All right, thank you. Have a motion to pass. Is there a second? Have a second. Any further discussion? All those in favor? Opposed? All right, the ayes have it. You have your study committee, and I think we'd be real interested when you call these meetings. I think a lot of interest here in seeing exactly where it does stand.
Yeah. Thank you, Chairman. Thank you, committee.
Next on our agenda is 1414, Chairman Rick Jaspers.
Thank you, Chairman Harden and committee, for letting me be with you today and ask your favorable consideration in passing the House Study Committee on School Security. I really need to get your permission to allow us to move forward to this. I know it's a very serious matter. I think everyone in this room has been contacted by a constituent, student, parent on this issue due to things that happened in Florida and other states. You know, it's something that we've been thinking about for years. If you look back at House Bill 60 that we passed 3 or 4 years ago, we gave students and school systems the ability to arm teachers. And that hadn't been taken up very much, but this hopefully will create other action items that schools can take part in. We're looking at, as you see on your bill there, line 2, we're looking at the safe environment of schools, 4 through 6, factors that are facing it, and wanting to curb violence that we've seen in our children. Joint it's been very interesting, the emails and phone calls I've gotten from across the Southeast in the last week since we dropped this bill. If you look on line 12, it does have a larger committee size than most. It has 9. Speaker, when we were talking about it, wanted to make it broader, so there'll be more people on it. It'll have 5 meetings. We'll have them across the state. They'll be open. We're listening. We're looking for other ideas that are out there, because as we all know, Georgia's a big state, has lots of ideas, but lots of differences in their needs. And we look forward to listening and looking at solutions that we can find. And Mr. Chairman, that's my study committee.
Number 23.
Thank you, Mr. Chairman. Thank you so much, Chairman, for bringing this. This is possibly the most important thing. This committee, in my time, this is my 6th session that we've had before us in this committee, and I cannot express how grateful I am for you for bringing this resolution.
Thank you, sir.
I would like to encourage you to consider adding as members of the committee, members of law enforcement. And the reason for that, for example, there are law enforcement agencies that have had to deal with school security issues. I look at Cherokee County Sheriff's Office just last year, headed off what could have been a tremendous tragedy in Etowah High School, and it was actually my former mayor was a detective on that case, and got tipped off, and they actually put some things in motion to deal with it before it actually got there. And I think having feedback from individuals like that who've dealt with this and actually proactively prevented a tragedy like that would be invaluable to this committee. And if you're willing, I'd like to just offer an amendment at the appropriate time to include members of the law enforcement community.
I think Representative Turner, they'll be a part of it.
Okay.
I mean, I think just generally this will be just the folks that are paid to move around with the committee, but I agree, they will be part of it. I mean, because they are an integral part of safety. That's what we've entrusted them to do throughout our state. And they will be, because they'll be part of the advice and people that come to meetings that we'll invite to hear.
Thank you.
That's up to the committee.
Thank you.
Yes, sir.
No, and I agree. That's an excellent suggestion. But we do have career law enforcement people in the House too that I'm sure will be a part of this.
Yes, Mr. Chairman.
Number 17.
Thank you, Mr. Chairman. Again, Chairman Jaspers, I want to say thank you for bringing this study. I know that we've all received lots of phone calls as it relates to the safety of our schools and our children, and I can commend the speaker and leadership and yourself because we took action very quickly to start studying this issue. And some of the criticism that I had received back home is that we had not acted sooner. And I think anytime you act knee-jerk reaction out of emotion, you can make some mistakes. But one of the things that I just wanted to add was making sure that in this conversation that we hear from both parties, Republican, Democratic Party, from the ones that may not want us to have any firearms at all the way to the ones who just are going to live and die by the Second Amendment, and just hear every angle of every conversation to make the best decisions. And I know you'll do that. I appreciate you.
Yeah, we all have children.
That's right.
Across the board. Yes,
That's
sir.
right.
Number 16.
Thank you, Chairman. Thank you, Chairman. So thank you for bringing this study committee. And of course, all of us want our kids safe, whether they're in school, in the communities or not. But what I want to ensure the context of the study committee is not just around, you made the statement that we've passed legislation to allow teachers to arm themselves. And so as a parent, I would be concerned that school is starting to look like jail. And I want to make sure that as you guys are studying and doing your research, that it is about safety, but I think we got to have common sense safety. And I will hope that parents, students, teachers, and administrators, as well as law enforcement, would be included in this conversation. Because as a parent, I find it disturbing whether my kid is at the school or not, when I go into a facility and you have to walk through metal detectors and things like that. And I get safety. I absolutely get that. But I think we also, as we're looking at this situation, that we need to think about the image that we're having in kids. And one of the things that I would love to have you all explore is that the security that we do have in the school, that maybe we can take a different approach into their attire as well. We want the students to understand that they must behave in a manner that is appropriate. We want outsiders to know that we're not going to tolerate them coming in disturbing and harming our kids. But at the same time, I think we could take a different approach. So I hope that'll be something that you guys will look at as well.
Yeah, thank you for the suggestions. Yes,
Thank
ma'am.
18.
I'm sorry that I had to follow my seatmate, but I kind of feel like the approach I would like for you all to look in this as we move is the level of security who has access to the facility. Because if you look at the shooting in Parkland, this person was not even supposed to be on the campus. And I know nowadays what we're doing in school security is that we're changing how you can have access to those different doors. It's almost the way we operate here is that if you don't have a key card, you can't get in. And at a certain point in time when school is, classes are in, I think those doors should be secure. They should be secure. I know it's a cost of the state, it's a cost of the system, but to make sure that we don't have what happened in Florida to happen in Georgia, I think that would be something that maybe we can look at.
Yes, sir. I think you'll see across the state there's a wide variety of how that's being done and not being done.
Number 21.
Thank you, Mr. Chair. Thank you for bringing this bill. I definitely think this is much needed, and I would urge you to really start looking at resources in place to look at mental health and how to direct people that need mental health services into treatment, because some of the things we do know is every shooter has been on psychotropic drugs, and a lot of people are going untreated with mental health issues. And I know when the Florida shooting happened, everybody's like, well, if you see something, say something. Well, they did. And I have a study committee looking at pathways into treatment. So if you get yours passed and I get mine passed, I would love to work in tandem with you in making sure that these dovetail, because they do impact each other. And our chronic mental health issues that are going unaddressed are the biggest drivers of shootings, of suicide, of the societal ills we're seeing today. So I would just urge you to look at that, and at the appropriate time, I'd like to make a motion.
Okay. Number 20.
Thank you, Mr. Chairman. To dovetail on what Representative Rakestraw said, sometimes these psychotropic medications that they're on can induce homicidal ideations. Sometimes they can induce suicidal ideations and psychosis. So I would like for the committee to look at the potential to, when a crime scene is discovered, and as we move forward and we investigate crime scenes, that it's cataloged, that if there are psychotropic medications at the scene of the crime, that be cataloged and be a crime statistic. Now, your pharmaceutical industry may not like that, but I think there's enough evidence out there to show that some of these psychotropic medications are not so good and can cause some issues. So I'd like the committee to undertake that one.
Yes, sir. Thank you.
All right, I see no further questions. Representative Rakestraw, it is the appropriate time for a motion.
I'd like to make a motion to pass.
Have a motion to pass in a second. Is there any further discussion? All those in favor say aye.
Aye.
Opposed? Motion carried.
Thank you, committee.
Thank you,
Look
Rick.
forward to working with everybody on this.
All right, next on our agenda, and the next three are hearings only at this point in time, but we have first, well, actually Representative Kirby called me and said that he would not be able to get here this morning, so we'll, House Resolution 1257, Representative Petrie.
Good morning. Thank you, Chairman. I've got some handouts going around I thought might be helpful. I think you have enough. Let's make sure. Okay. Chairman, this is House Resolution 1257. This is a study committee on the workforce shortage in home and community-based service settings. So the first thing I'll do, and I'll try to be real brief, but I do want to go over some good information I have here for you that I handed out as well. This came, by the way, this information came from our Southern Legislative Conference. Some of y'all were there this year in Mississippi, where we had a great deal of data about some of these issues that I want to mention to you briefly here this morning. So when we talk about home and community-based settings, we're talking about all of those things in the world of long-term care that allow us to keep people at home rather than in institutions. So obviously we're talking about skilled nursing facilities. On the aging side, our institutions, and our state hospitals are institutions. And as all of my colleagues here this morning know, we have dramatically in this state advanced forward in removing people with developmental disabilities and intellectual disabilities out of state hospitals and into the community. Likewise, we have really over the last 20 years especially dramatically allowed people in the community to have opportunities to be served at home as they age rather than be institutionalized in skilled nursing facilities. And so our skilled nursing facilities that are so important to the long-term care system, absolutely important, are there for the sickest of the sick. And as individuals age and their needs grow, our first route is to try to serve them at home where they want to be. Overwhelmingly, people want to be at home for as long as possible. They don't want to be institutionalized. And so that is what home and community-based settings is all about. That's what we're talking about. We're talking about home care. We're talking about assisted living facilities. We're talking about personal care homes. We're talking about community living arrangements, which are small residential settings for individuals with developmental disabilities. We're talking about all of these different services, adult day health facilities, day programs, all of these different ways we keep people in the community so they don't have to be institutionalized. That's what home and community-based settings are. Now, the crisis that we're addressing here in this resolution is a crisis of workforce. And this is an issue that nationally, I'm very involved with the Home Care Association of America. We meet nationally every year. And this is not just a Georgia crisis, this is a national crisis. We do not have enough people to take care of all the people that need care today. And so you might be interested to know that over the next 20 years, an average of 10,000 Americans a day reach the age of 65. Okay, so we are aging like never before in our history, and what's happening in the world of home and community-based services, we don't have enough people to take care of folks. We have more and more people to take care of, and we have fewer people to do that. And so let me just briefly go over some of this information that I think you'd be interested in very briefly. This is from Kathleen Uvari with the with AARP, and I want to mention some of the things demographically before I go on. Baby boomers turn 85 in just 14 years. That is the the largest segment of our population. Just 14 years, they'll be 85, okay? I want you to just a couple of things here. I want you to look at, you'll see some graphs here on the skyrocketing population of age 85. I want you to see that we're going to grow just in Georgia alone 315% in 85 plus population by 2050, okay? 315%. Meanwhile, so you need to understand this. So the majority of care in this country is provided by family caregivers, and that's a good thing, right? So there's formal caregivers, like what I do, and then there's informal caregivers. And praise God, the majority of our care in this country is offered by informal caregivers, spouses, daughters, sons, and that's a good thing. But here's the challenge that relates to this study committee. Demographically, we don't have children anymore. So my grandparents had 9 children. My daddy had 3. I have 2. And that trend, I'll promise you, is probably the same with every one of you. So we don't have the number of children to take care of ourselves today. And so look at this data here on page 7. So the family caregiver support ratio in the U.S. today is about 7 to 1. there's about 7 family members to care for somebody to 1. By 2030, that's going to be 4 to 1, and by 2050, that's going to be 3 to 1. So every day we have fewer people in that informal family caregiver pool to take care of ourselves, and meanwhile, we have fewer and fewer people in our workforce to take care of these people formally. And on top of that, thankfully, look at our level of employment today. We have the lowest unemployment in generations, and particularly with demographics that are caregivers in this state. For example, with African Americans, lowest African American unemployment in history. And so, and largely caregivers in states like Georgia are minorities, and they are female, almost entirely female. And so there is a real crisis for how we're going to have the caregivers going forward to take care of people. And that is what I'm trying to point out here today. So let me just point to one other thing in this data. You can read over this later, but I think I had one thing. If you'll look on page 9, and this has, been the case for as long as I've been in this industry, about 90% of people, you'll rarely find somebody that wants to be in an institution, right? 90% of folks want to be at home. They want to age in place. And meanwhile, home and community-based services, which is what we're talking about, are far less costly than institutional services. So those are the things I wanted to point out. But as it relates to that, so Medicaid, all right, we're all involved with Medicaid, right? Here, we are dealing with that budget in Georgia. So 57% of our Medicaid long-term care budget in Georgia, okay, 57% of our Medicaid budget is spent on 25% of our population. I want you to think about that a minute. So Medicaid, $10 billion program in Georgia, 57% of our money go to 25% of our population, and that population is, guess what? Age, blind, and disabled. Just who I'm talking about here. It's old folks and it's developmentally disabled folks. That's taking 57% of our funding. So, not only is this a crisis for the industry, not only is it a crisis for the individuals we've got to take care of, it's a crisis for state budgets. We've got to find a way to serve people for less in the community because we don't have enough money to take care of folks as this population ages. As we add 315% to that aging population, that's just talking about aging, folks. I didn't even mention IDD. So, meanwhile, we've got today 9,000 people on waiting list in IDD waivers. I think y'all are aware of that. There are 9,000 people waiting for home and community-based alternatives to institutional placement just on our now and comp waivers, which serve individuals with developmental disabilities. So you put all this together, there is so much data that this is a crisis, and we don't have enough people to take these jobs. We're competing with, we're talking about caregivers who are obviously not highly skilled or trained, and so the wage is such that due to reimbursement, that it's difficult to compete. You're hiring people that otherwise are working in retail, they're working in fast food, they're working in, that's who we're competing with. We're competing to try to find people that can take those jobs, but moreover, they have to be people that have a heart to take care of people because you're not just hiring somebody for retail. You need the right kind of people. They have to pass a criminal background check. They have to pass a drug test. Folks, you do all that culling, you get down to a very small percentage of our population that even can take these jobs and much fewer that want to take these jobs because these aren't glamorous jobs, folks. We're talking about changing diapers. We're talking about bathing people. We're talking about feeding people. We're talking about doing all those intimate things that have to be done to take care of someone to keep them at home. And it's not the most glamorous job. So I hope I've done a pretty good job of trying to explain why we have a crisis coming. And my hope is that we can study this. We have got to come up with ideas. Just as you just discussed with Chairman Jaspers, we've got to come up with ideas about school safety. Well, we better start thinking about ideas for taking care of people going forward, or we're going to be blindsided by this and just have no way to do it. Thank you, Mr. Chairman.
Okay, thank you. Number 18.
Thank you. Listen, Ms. Representative, I certainly appreciate the presentation that you've made.
Thank you.
It is really enlightening because I'm trying to, as you make that presentation, if we end up with fewer and fewer people to provide more and more services,
that's right.
The law of supply and demand is going to soon kick in, so that the that it's going to cost to be able to take care of those people is going to.
Absolutely. Yes, sir, that's correct. And it's going to cost government more, and it's going to cost private individuals more. Much of this industry is privately paid for, private duty home care, for example. So as that labor force pool gets smaller, we have to drive up rates, which means people have to pay more for it, which, by the way, means this. Interestingly enough, you raise a great point. If they can't pay for it, guess what happens?
Institutionalized.
They get institutionalized, then who pays for it?
We do, and
We
it's
do.
more.
75% of skilled nursing costs are paid for by government. So we want people to be able to pay for their own care in the private sector, or we end up taking care of them for them. Excellent point, Representative. Thank you.
You know, as we build that wall, we might need to have a pretty good sized door.
Thank you, Representative.
Thank you for bringing this. I see the consequences of this on a daily basis in the emergency room. Have you looked and explored at potentially looking at a Medicaid waiver that would supply some type of revenue stream? The way we look at, if we're funding 50% of that now, we could actually use some of the existing Medicaid funds to route and fund some of this care, or fund some of the programs for like putting in the workforce, like CNAs, more CNAs in our technical colleges and things like that. Recognizing that we need some type of steady stream supply to care for these folks, because you're right, the day of reckoning is coming.
It is. Haven't explored that, Representative, but that's the kind of ideas I'm looking for. I mean, we need ideas. We need to really think this through. Thank you for your recommendation.
Number 12. I'm sorry, number 12.
Okay, okay, is the mic working? I was just wondering, when you all are looking at this, and I think Representative Dukes kind of talked about it, are we going to look at paying the people that take care of these people more money? And what are your thoughts on the Medicaid expansion? I think that could help curtail a lot of this deficit if we even looked at that plan. Because we know that people that are taking care of people, they are not paid. So that is one reason that we have the turnover rate is great because of the pay. So in y'all study, I would hope that you look at paying people that take care of people with the income that they can afford to do the job, so that they will want to stay into this, because a rule of thumb is people that truly work for a living are the ones that are paid the least.
Well, thank you for your comments, Representative. I think every agency that employs caregivers wants to pay them as much as they can. I can guarantee you that, and the reason they do is because they're competing. The scarcest resource, Economics 101, the scarcest resource in this industry is labor. You want to pay your aides better than anybody else. The problem is, to do so, you have to be able to be profitable to do so, and or you're out-competed by someone else. And so that's the challenge, but I appreciate your comment.
Number 21.
Thank you, Mr. Chair. So you were looking for ideas, and again, I'm going to talk about mental health and addiction, because the more of those people that we save, we've got so many people that are homeless and on the streets, and they could use jobs, and a lot of them have mental health and or co-occurring addiction issues. So the more of those people that we save and get on a good track and get coping in life, then the more people we have to bring into the pool of caregivers, and and not just homeless, but a lot of our people that are struggling and not fully functional at this point. They're not working. They're not part of that workforce. So the more of those people that we help, the more we increase the people capable of being in that workforce and putting into careers like that. So I just wanted to give that idea since you were asking for ideas.
Thank you, Representative.
Number 20.
I don't want to make this an issue about Medicaid expansion, but it is a policy decision and policy choice that we will have to discuss, I'm sure, in the future. But just understand this about Medicaid expansion. I may be saying something you already know, Representative, but the expansion criteria goes to those who are able-bodied childless adults. You were talking about those that are deaf, blind, and disabled. We expand Medicaid to that population, to the able-bodied, it takes away from the very population you're talking about that's at risk. I just wanted to point that out.
And I recognize that well, Representative. The Medicaid expansion would do nothing for the age blind and disabled population because we already serve them with Medicaid. They have long received all the benefits of Medicaid and still do. And indeed, my personal position is that, yes, we aren't doing that well enough yet to expand to able-bodied. There's so much more we can do to take care of those that are the most sick and the most disabled in our society, in my opinion. But yes, sir, I understand your point. Thank you.
Number 25.
Thank you, Mr. Chairman. Thank you, Representative Petrie, for bringing this bill. This is definitely something that concerns me. I've had my grandparents, I was very fortunate and blessed for them to be in my life for so long, but I did see this process go on, and I saw the effect that the long-term care took. But we were fortunate enough that we were able to have that home-based health care. My question is around the cost that you talked about. So am I understanding you correctly when you're saying that this is something you have a background in, or you work in this area?
I do. I'm a home care provider.
Okay, excellent.
Yeah.
So maybe you might have insight, or maybe this is something that the study committee looks into, but I'm very curious as to why the institutional costs are so much higher. Is it an issue of the folks who are credentialed that are in there, that you have to have, doctors or degreed folks, so we have to pay them more, or is it the overhead cost of the buildings? I'm sort of curious if you have any insight you can provide there.
Well, yeah, I'd be glad to. It's at the end of the day, again, our institutions are so important, and I want to emphasize how strong a supporter I am of our skilled facilities. We need them, but they're there to serve a skilled population. And so when you have someone that really what you have is this. If you have someone who's living at home alone, and what they really need is somebody to buy groceries for them and to help them get up and bathe in the morning, and if somebody can buy groceries and maybe come in and bathe them 3 times a week, if little things like that can help them stay at home, and then that is so much cheaper than that person, because they don't have that, being institutionalized at a multiple-fold cost. And so what you have historically is that people with lower incomes that don't have the ability to pay for those services wind up prematurely institutionalized. So they end up needing a little bit of care. Because they don't have alternatives, they have to go somewhere where they get a lot of care. So that's why it's more expensive. So at the end of the day, the skilled facilities have to be more expensive because of all those things you alluded to. They have skilled care and nurses and probably more regulations on them than any industry on the planet. And so all of that lays over that service makes it more expensive. It's simply cheaper to serve people at home. There's no question you can do it for less money. We can serve so many more people that way. And so the challenge, again, is going to be do we have enough people to do that? Because you can serve more people in a congregate setting. You can serve more people with fewer people in a congregate setting.
Thank you very much.
Thank you. Good point.
Number 27.
Thank you, Chairman. Representative, thank you for bringing this. This is really a great exploration for us, because the numbers that you quote are outstanding. You said 57% goes towards 25%?
That's correct. Yes,
That's
ma'am.
amazing. I just wanted to point out one thing, that I had a financial planner talk to me about this same type situation, and she was saying how that you see a lot of people in institutions that are up walking around doing things for themselves, and all they need is a little help.
Right.
But what happens to them is, because there is no one there, they get institutionalized, and all of their wealth goes with them. Say like a person's getting $1,000 a month on Social Security.
Mm-hmm.
Well, whereas that money could be used in the private setting for that person, it's completely consumed by the institution, going at a very much higher cost than it would have taken for that person to have stayed at home. I got my mic cut. Oh, okay. Yeah. So it has benefits in many ways, and that was just one financial angle that that she was talking about, because that's what she does. But certainly the humanity, the humane part of this is taking care of old people. I mean, we as a society, if we don't take care of our children and we don't take care of old people, then something is seriously wrong with us. So thank you for bringing
Well,
this.
and thank you for that. And I do believe ultimately what we need to have a thriving long-term care insurance market, which we don't have, and unfortunately, only by the way, 1/4 of 1% of Americans buy long-term care insurance. And we need to one day have where people are thinking ahead and preparing for these things so that they aren't dependent on government. One thing also I would add too is I want to say this because I think everybody here needs to know this. We have a governor that has been so focused on improving services for that age-blind and disabled population. And so these are the folks that absolutely are the least of these, as you talk about with seniors and children. And long as I've been here, I have seen him focus on these populations. And I think we all appreciate that. But this issue today I'm talking about is more about how are we going to do it going forward when, you know, what's that labor force going to look like going forward to be able to continue to take care of that most disabled and most vulnerable part of our population?
Number 23.
Thank you, Mr. Chairman. You're extraordinarily knowledgeable. I think you're perfect for this particular topic. The only comment I have is it sounds like you have a lot of ideas. And I think that this is the reason why we form study committees. Somebody has a lot of, they can recognize what the issues are, but they don't necessarily have all of the answers. And I commend you for that. And at the appropriate time, I'd like to make a motion, Mr. Chairman.
Thank you.
Okay. Number 16.
Thank you, Chairman, and thank you, Representative, for bringing this bill. And, you know, as I was listening to you and looking around the room, I believe about 90% of us in this room will be in that category. So to honestly, we do need to be thoughtful in thinking about how we are going to improve, actually have the workforce. But I think we also, and I don't know if your study committee will be able to handle that, but we also need to take a deep dive into Medicaid in all aspects of it. Because again, you're saying 57% is used on 25% of if it's this population, it will probably, that number's going to grow. But we also have the other aspect of Medicaid that is growing as well. So, I mean, I don't know if we, find a balance, because even talking about long-term care insurance, we have to have a wage conversation. We have to have, affordable care insurance conversation. So, and again, I know yours is on workforce, but it has to be paid for. And again, looking around this room, the majority of us are closely getting to that number. So I hope that you are able to do this and you guys can take some deep dive in how it's going to be paid for as well as filling that workforce.
I think that's an excellent point, Representative. Thank you.
All right, and as far as the motion is concerned, we did have this and the next one listed as hearing only.
I knew that.
But thank you very much for your time. Now, I
Thank
did
you.
have one request to speak to this, and from the public. Would you like to speak now, or if at the next time we will take a vote, would you prefer to wait then or speak now? All right. Well, if it's all right with you, we do have another one to hear, and it would be we're running short on time. If that's all right. Okay.
Thank you, Chairman.
All right. Next on the agenda, we have House Resolution 1374 by Representative Brett Harrell.
Thank you, Mr. Chairman and members of the committee. What this resolution does is it seeks to form a study committee looking at the various professional licenses within the administrative attachment of the Secretary of State's office and look at all those licenses and the fees that are paid and so forth. This is my first time before your committee. This is my 8th year here, but during that 8 years I've served on regulated industries where we hear issues every year with the various industries that are licensed within the state of Georgia. Many times those issues deal with the scope of practice in various communities, what the continuing education requirements might be, what the fees these various licensed professions pay. And like any other organization, over the years, those professions have grown, and they've been, and the administration at the Secretary of State's office may or may not have been able to respond to the changing demand in the marketplace. So what we seek to do is to just do an update and review. If you just went to the Secretary of State's office, you could see 41 different categories of licensed professions in Georgia. And for example, one of the newest licensed professions the last year or two was lactation consultants. There are only 42 licenses in the entire state. Only 42 people in the entire state hold that license. But compare it to one of our older licensed professions, cosmetologists and barbers. There are over 26 different licenses under that category, with over 89,000 Georgians holding those licenses. So the requirements of the board and the requirements of the various industries just hasn't been looked at in quite some time. The Secretary of State's office budget is approximately $8 million a year, but the revenue from all these licenses and fees is over $24 million. So there's obviously a disconnect there. So probably some professions are paying a lot more than it costs to operate their boards. Some others may be paying less. And so we'd like to just look at that in the administration. And then finally, one of the issues that came up this year, in 2010, we passed a law that requires, we have an organization called the Georgia Occupation Regulation Review Council, GORC, that is available to look at all new licenses. But one of the other things this organization is supposed to do, made up of various state agency heads, is they're supposed to do a 7-year annual review of all these licensed professions once every 7 years, just to look at all these various aspects. Well, unfortunately, the state has failed to do their job, and that organization has not been doing these statutorily required updates. So every year, over in Regulated, these industries come and ask us for various modifications to their industry, and too often we're flying blind, and we don't have the data that we might need. So this study committee seeks just to do that, to work with the Secretary of State's office, the Georgia Occupation Regulatory Review Council, the various industry parties, to look at the regulatory requirements, licensing, and ultimately, I think where most would agree we'd like to get to is that the fees charged to the various licenses cover their costs, but don't turn into too high a burden, which just discourages people from getting involved in those industries. Some of the industries that the previous speakers spoke about are some of those licensed professions, and one of the reasons we may have fewer people offering is because the burdens to get involved and the hurdle to get involved in that profession may be too high. That's what the resolution seeks to do. I'd be glad to answer any questions if I could.
Number 16.
Thank you, Chairman, and thank you, Representative Harrell. I'm over here smiling, thinking, how fast can we do this? One of the things that I have wanted to see is for those revenues to actually be restricted to those actual departments within the Secretary of State, because currently, as you know, even though those individuals are paying those licenses to the Secretary of State, those funds go into the general fund.
That's correct.
And then they're budgeted back out, and they aren't able to. Those boards aren't able to do the kind of work that they need to do, whether it's following up, ensuring people are doing what they need to do, because the funds aren't there, and the funds aren't there because we don't put it back. So I will hope that as you're doing the research, that the conversation around restricting those professional licenses fees to the professional licenses department in their budget. So
I agree,
those are my
I
two
agree
cents.
entirely, and we're in this year hopefully we'll have an opportunity. We have a constitutional amendment that is working through the General Assembly. It was House Resolution 158 that we've passed that will allow constitutionally for us to dedicate fees. So if that were to pass, and I think the general public is likely to support such a thing, which is a simple question: should we spend the money where we tell you it ought to, you know, that where we're collecting it. So that, to your point, that would work in tandem exactly with this kind of work. So thank you.
Number 17.
Thank you, Mr. Chairman. Thank you, Representative Harrell. I know in the past we have, or I have, the way I understand it is that like the nursing board came out from under or the pharmacy board or the dental board, someone in the past, they came out from under the Secretary of State's purview or whatever, or responsibility, and now they're a standalone board. Is that some of those things? Because I think the nurses are ones that have asked to be a standalone board and those kind of things. Is that what you would be studying as well?
I think a component part is the efficient and effective operation of these various licensed professions. So if the work were to indicate that there was a more efficient, more effective way to govern an industry, to provide services, to do the follow-up, then that could certainly be one of the outcomes of the study. It's not a particular focus going in. I'm not looking to break up anything, or detach or reassign. I will mention there are 2 members of our body in the House that happen to be running for Secretary of State, and both of those members signed on to the study committee. So our potential candidates running for Secretary of State also feel this is not seen as competitive or anti-Secretary of State's office in any way.
Okay.
Florida recently, I'm not sure if you're aware of some of the representatives in Florida recently dropped some legislation to do away with some licensing requirements of like barbers. If you can cut hair and people want you to mess up their hair, you can pay them, and you know, and so I thought that might be an interesting thing to look at. In that we have too many license requirements in Georgia.
I do not disagree.
let me add one thing here, Representative Lickey, that no boards stand alone. As a matter of fact, when the medical, pharmacy, and dental boards now are attached to the Department of Community Health rather than to the Secretary of State's office, but none of these licensing board does stand alone. Number 18.
Thank you, Mr. Chairman. Thank you, Representative Harrell, for bringing this legislation, the proposed study committee. I only can concur with you because basically there needs to be some kind of logical, rational approach to how we go about the licensing process and also how we go about charging for it. I mean, if we're using these license board as a revenue generator, I think that should be considered. You know, we should pay close attention to it. And if that is what we're doing, then at least we need to say we're doing that. And, you know, not a little backhand way of charging people additional monies so that the state can do whatever the state wants to do with my money or your money or our citizens' money. I really appreciate you for bringing this legislation.
Thank you.
Hopefully it'll add some logic to it. And Mr. Chairman, at the appropriate time, I'd like to make a motion.
This is a hearing only on this particular resolution, but number 20.
Thank you for bringing this. I often get complaints from licensees, from massage therapy boards, from cosmetology boards. I get a lot of phone calls about harassment from these boards. I often have to call the Secretary of State's licensing board officials and tell them to back off. I think some of these boards are just a little bit Hitlerian in their governance. And I hope you all can look at that situation as well. I will also tell you that many of these folks have to go through CME requirements or continuing education requirements. That is a tax or fee on themselves. They have to continue to upgrade and stay professionally developed and updated. That in itself is a burden. And when you tack on these fees and licensings to even just to have the right to feed your family in the state, I think that's a problem. And so I really thank you for bringing this resolution.
Well, thank you, sir. You know, one of the most gratifying things, and I'm sure you've all experienced this, is when a constituent calls and you're able to help them solve a problem that's very personal to them. And to your point, over my tenure here, I've had dozens of constituents in all sorts of different industries call and just say, you know, I just graduated, I just got my certificate, I've got a job lined up, but I can't go to work until the board issues, you know, that license. And it's, sometimes it's just a phone call from us, and it happens, and it makes you feel good that you could help a constituent. But at the same time, that disturbs me that I make one phone call and the problem is solved. Why isn't it operating as it should without the necessity of an elected official stepping in, which I'm glad to do, as I know all of you are. And then to your point about CE, we have, and my numbers could be slightly off. I didn't, this was not a point I was going to make this morning, but one of our professions, the barbers and cosmetologists, some of those licenses require up to 1,500 hours of classroom training.
Yeah.
An EMT, 150. So, I mean, here's the guy resuscitating your heart in the back of an ambulance has 10% of the classroom training that the fellow that's cutting your hair. So, you know, those are the kind of things that we might, I'm not saying one is right or one is wrong, but those are the types of things that we probably ought to consider.
Thank you.
Okay, thank you very much, Representative Harrell, and we will be having some more meetings. We've got the time and to do that. And thank you to all of you who came this morning. And I'm sorry at these we don't have a lot of public input, because that's the reason we are creating the study committees, is to ensure that the public has a chance to express their opinions in those study committees. And we are adjourned.